5 bedtime habits that are silently destroying our loved elders. As our loved elders age, their bodies and minds become more vulnerable to even the smallest of daily routines. Among these, bedtime habits play a surprisingly large role in their long-term health. Many of these habits are so ingrained in our daily lives that we barely notice them, yet for seniors, they can quietly chip away at physical, emotional, and mental well-being. You might see your elderly parent or grandparent follow the same nightly ritual for years, believing it's comforting. But what if some of those routines are slowly doing more harm than good? It's not about judgment, it's about awareness. When we know better, we can do better. That's especially true when it comes to caring for the people who once cared for us. Bedtime is more than just a time to sleep, it's a vulnerable time when the body prepares for healing, memory consolidation, and rest. For elders, this process is more delicate than ever. Disruptions or unhealthy routines can have cascading effects, from broken sleep to increased stress hormones to even a greater risk of illness or injury. In this video, we'll cover 5 bedtime habits that are silently affecting the well-being of our elders. Some of these habits may seem harmless or even helpful on the surface, but under the lens of modern medical research, they tell a very different story. From disrupted sleep patterns to increased fall risk and emotional stress, these nightly routines are contributing to a range of preventable health issues. Doctors and elder care professionals are raising alarms about how seemingly simple acts like watching TV before bed or drinking a glass of water late at night can have serious consequences. Unfortunately, these issues are often overlooked because they unfold slowly and quietly. That's why it's crucial for caregivers, family members, and loved ones to become aware of these risks. By the end of this video, you'll not only understand the dangers behind these habits, but also learn safe and supportive alternatives. You'll gain practical insights to help improve your loved one's quality of life. And most importantly, you'll be empowered to protect the people who once protected you. So take a seat, open your heart, and let's explore the 5 bedtime habits that could be silently destroying the health of our beloved elders. Habit number 1, watching TV or screens right before bed. It's become a modern comfort, falling asleep with the television humming in the background or browsing on a tablet to relax. But for older adults, this bedtime habit can wreak havoc on sleep cycles. As doctors warning, blue light emitted from screens can suppress melatonin production, the hormone that regulates sleep. This can lead to chronic insomnia, poor memory, and even increased risk of nighttime falls due to mental fog and fatigue. Elderly individuals are already at a natural disadvantage when it comes to sleep. As they age, their internal body clock, known as the circadian rhythm, becomes more fragile. Melatonin production naturally decreases, making it harder to fall and stay asleep. When elders engage with screens, TVs, smartphones, and tablets in the hour leading up to bedtime, they're exposed to blue light. This specific wavelength mimics daylight and confuses the brain into thinking it's still time to be awake. This delay in melatonin secretion can push back their sleep onset time, fragment sleep throughout the night, and cause waking fatigue. Over time, poor sleep increases the risk of cognitive issues like memory loss, depression, and even dementia. Physically, poor sleep leads to decreased coordination and balance, both serious issues for fall-prone seniors. Therefore, encourage elders to turn off screens at least 60 to 90 minutes before bed. Replace screen time with relaxing activities like listening to classical music, doing light stretches, meditating, or reading a printed book, and consider blue light blocking glasses if screen use is necessary earlier in the evening. Habit number 2, drinking fluids right before bed. A warm beverage before bed can feel comforting, especially for older adults. However, consuming fluids too close to bedtime can cause unintended consequences during the night. Urologist Dr. Anita Jems explains, nighttime urination, known as nocturia, can interrupt deep sleep cycles and significantly increase the risk of nighttime falls. For elderly individuals, frequent trips to the bathroom in the dark can lead to dangerous accidents like fractures or head injuries. Nocturia, the frequent need to urinate at night, is common in older adults due to reduced bladder capacity, decreased antidiuretic hormone production, and increased fluid retention. Even 1 or 2 awakenings during the night can drastically reduce REM sleep, which is crucial for memory and emotional regulation. Fatigue from poor sleep the next day reduces alertness and balance. Combine this with low lighting or cluttered walkways, and the risk of falling increases sharply. In some cases, elders may try to rush to the bathroom, increasing the likelihood of tripping or dizziness. Our beloved seniors must limit fluid intake at least 2 hours before bed, avoid caffeine, alcohol, and high-sodium drinks in the evening, install motion-activated nightlights to make nighttime navigation safer, and keep essential items like walkers, slippers, or grab bars close to the bed. Habit number 3. Going to bed without managing medications. Taking medication properly is critical at any age, but especially for seniors with chronic health conditions. Going to bed without properly managing their nighttime medications can be dangerous. Dr. John Sanders, a geriatric pharmacist, warns medications like sedatives, pain relievers, or blood pressure drugs can interact in unpredictable ways if not taken correctly. Missing a dose, taking a double dose, or mixing medications without oversight can lead to serious complications such as dizziness, falls, and even cardiac issues. As we age, our liver and kidneys process medications more slowly, increasing the chance of buildup or interactions. Seniors often take multiple prescriptions, known as polypharmacy. This makes timing, dosage, and consistency extremely important. Taking sedatives too late can result in grogginess or confusion the next morning. Missing medications like blood thinners, insulin, or beta blockers can have serious health impacts overnight. And without a clear system, it's easy for elders to become confused about whether they've taken their pills. Therefore, use a pill organizer labeled by day and night, create a nightly medication checklist, and involve a caregiver or family member in double-checking and schedule regular medication reviews with a pharmacist or doctor to adjust dosages as needed. Habit number 4, sleeping in a cold, unventilated room. A cool bedroom may help some people fall asleep faster, but for elderly individuals, sleeping in a room that's too cold or poorly ventilated can be a serious health hazard. Dr. Elena Rivera, a senior care physician, explains, older adults are less efficient at regulating their body temperature. A cold, stuffy room increases the risk of hypothermia, joint stiffness, and respiratory infections, especially for those with arthritis or heart problems. Aging affects thermoregulation. Seniors may not feel cold the same way, yet their core body temperature can drop quickly in a chilly environment. Combined with low mobility, it can lead to discomfort or even health emergencies overnight. Poor ventilation traps carbon dioxide, allergens, and dust, worsening sleep apnea, asthma, and other respiratory conditions. Waking up feeling stiff, coughing, or congested are all signs of poor bedroom conditions. To live long and safe, keep room temperatures between 68 to 72 degrees Fahrenheit or 20 to 22 degrees Celsius. Use layered, breathable blankets instead of electric heaters. Use an air purifier or crack a window slightly to circulate fresh air, and avoid heavy curtains that block ventilation entirely. Habit number 5, going to bed without emotional closure. Our final habit may be the least obvious, yet it has one of the deepest impacts. Going to bed feeling lonely, anxious, or emotionally unresolved can lead to poor mental and physical health over time. Dr. Karen Lee, a geriatric psychiatrist, shares emotional distress triggers stress hormones like cortisol, which interfere with sleep quality. Chronic emotional tension can lead to depression, anxiety, and even increased risk of cognitive decline. Emotional wellness is as important as physical wellness, especially at bedtime. Elders may experience unresolved grief, worry about health, financial stress, or feelings of abandonment. Going to bed with these emotions often results in racing thoughts, nightmares, and fragmented sleep. It also contributes to elevated cortisol levels, which impair memory and weaken the immune system. Over time, emotional neglect can spiral into chronic mental health issues. To create emotional closure, Help elders end their day with a gratitude practice, prayer, or brief journaling, call, or visit, even for a few minutes just to connect. Encourage light conversations, storytelling, or reminiscing about positive memories, and if emotional struggles persist, consider involving a counselor, support group, or elder therapist. These bedtime habits may seem small, but their impact is anything but. From blue light exposure to nighttime loneliness, these behaviors can silently erode the well-being of those we love most. Awareness is the first step toward prevention. Tonight, take a moment to check in with the elder in your life. Talk about their routines. Help them build new bedtime habits that support comfort, safety, and peace of mind. Because our elders deserve more than just sleep, they deserve rest, healing, and dignity. If this video helped you, please subscribe to our channel, Elder Wisdom Table, for more insights on aging with care and compassion. Leave a comment, share your thoughts, or ask us a question below. And remember, caring is the most powerful medicine of all. Thank you for watching. See you in the next video.